Hey, good morning. This is Doug Field, the CEO of the Institute for Healthcare Consumerism, and I want to welcome you all to this week's edition of Healthcare Consumerism Radio. And I'm joined by my co-host, Managing Director Brent Macy. Brent, good morning.
Good morning, Doug. It's Friday, huh?
It's Friday. It's a beautiful weekend here in Atlanta. College football's in full swing, and so is the NFL. Life is good.
Oh, that's right. That was a great game last night if you're a Denver Broncos fan.
It sure was. Well, we got a jam-packed program today, and a lot of exciting stuff happening around healthcare consumerism and around, change taking place. And, without a doubt, one of the most important open enrollment periods in probably the last 30 years of healthcare and employee benefits. And joining us to talk about that and what they're doing is Josh Stevens, CEO of Keas, the market leader in corporate health. Hey, Josh, good morning.
Good morning.
Hey, good to have you on the program. You guys are one of our regulars.
It's great to be here.
Yeah.
We appreciate that you guys are amplifying all the issues that are helping drive the disruption in healthcare these days.
Yeah, give our audience just a reminder of Keas's, business model and what you guys do and your place in the space.
Sure. As the leader in employee engagement, Keas is an online platform and an online application that we sell to corporations to help employees utilize and leverage their benefits, particularly healthcare. Because what we know is that employee engagement is at an all-time low, and HR department's biggest challenge is getting employees to engage in the benefits that they are offered. And healthcare is the most expensive and most important and strategic benefit that employers offer. So if employers can drive more engagement of the health benefits, they can bring greater value to the employees, make them healthier and more productive.
Now, Josh, you guys just actually conducted a survey. Tell us a little bit about the HR survey that you conducted.
So we went out and talked to HR executives around the country to understand the impact of the ACA and what the challenges they were facing regarding compliance with the ACA, and also the pain points as well as the priorities for 2014.
Mm-hmm. Now, the compliance issue is pretty big in the space right now with ACA, and what was the reason for conducting the survey? To look at the healthcare law and how people comply with it, or were there other factors that you wanted, or other issues that you wanted to uncover from the survey?
Well, we think there's really an untold story that we've been seeing across the country as we talk to hundreds of corporations around healthcare benefits, engagement of those benefits, and the ACA. Mm-hmm. The story we were hearing in the field was that the ACA was really not a big deal for most American corporations in terms of compliance, that most corporations were ready, and that healthcare has already been such a priority for America's corporations that the ACA is making healthcare a priority for all corporations, big and small, really was a business-as-usual story for the large corporations that we serve. Where we saw some interesting insights were that the smaller corporations were probably the most impacted. There's probably greater pain in terms of smaller firms that hadn't offered health care to all that may have to extend coverage. But we found that it was pretty much the ACA compliance and regulations and readiness was largely a non-issue for the large corporations of America.
Mm-hmm. You talk about this year's open enrollment period, Josh, being healthcare's trillion-dollar moment. What do you mean by that?
Well, if you look at more healthcare is purchased effectively during the open enrollment workflow than any other time during the year, and it's effectively a trillion-dollar purchase of healthcare. If you look at 100 million American employees and $10,000 of average spend per employee per year, that gets to the total amount. And of that, we know that there's a tremendous amount of health dollars that are wasted through inefficiency of service delivery and also behavioral effects that, if changed, could massively improve the health of employees and employee populations.
What do you think is going to be the impact this fall and into 2015 of exchanges, both private and public?
So we're hearing that the exchanges, that's a good question. Exchanges I think it's going to be an ongoing story that we're really in the preseason of still from our perspective. Mm-hmm. We focus on large employers that really employ more than 2,500 employees, and by and large, they aren't participating in the exchanges as of this benefits enrollment season. We think that we'll see a greater take rate on exchanges 12 months from now, but even then, it should be a significant minority, not nearly a majority of American corporates moving to exchanges. The self-insured model for American corporates is a strategic asset, is what we've been hearing from our employer partners. If they feel they could get value add from an exchange, of course they'll do it. Right now, that's very unclear, and I say that because the feedback from the field has been employers see the health benefits, the self-insurance, and the non-exchange approach they're taking as a competitive weapon that companies can use to attract and retain talent. The more that companies move to exchanges, particularly if they're shared exchanges, the less they have differentiators on benefits. And the number one way employers can attract and retain talent after job content and salary is premium healthcare benefits.
But if we see, current surveys kind of support your thinking is that, there's early adopters right now, but as results come out on how defined contribution exchanges are performing and what that benefit experience is for the employee consumers, if we start to see adoption across vertical markets at a above predicted rate, I think you could see a giant sucking sound, because if it is about talent retention and talent acquisition, if my competitors are doing it, I'm probably going to be leaning to do it as well.
I think it comes down to who offers the greatest benefits that consumers want to use and which employers are getting the best utilization and engagement of those benefits to have healthier, happier, more productive workforces. I think I don't disagree with what you're saying, but I think an interesting follow-on to the theory about exchange adoption will be to cross-tab it against the size of company that are really picking them up. I believe we'll see small and mid-sized companies picking up exchanges far more than large enterprises who have, again, in our view, and this isn't our own original thought, this is based on the reflection we're hearing from hundreds of enterprise-sized corporations. It's a strategic asset for them that they don't want to be common denominator to others.
Yeah. Josh, you've got an exciting announcement to kind of share with our audience around open enrollment and what you're doing. Would you share that with us, please?
Well, sure. So Keas has been in the employee engagement business for about 6 years. And as the market leader in employee engagement, what we know is that if you can help an employer derive value from an existing cost or investment, such as healthcare benefits, you can help them drive more productivity, because more healthy employees will be more productive employees. They'll be at work more, and they'll actually be more focused and more present. We've been asked by our employer customers for now years, could we do for other benefits workflows what we've done for healthcare? And we really shied away from this at first because we're a growth company focused in a very specific area of employee engagement with a emphasis on health, and we didn't want to lose our focus and let it stick to our knitting. What we've learned is that the dynamics driving engagement in health, which for us are making it fun and social for employees, can be applied to other HR workflows and other benefits. We were pulled by many employers, starting about 20 months ago, into open enrollment as a workflow, saying, look, if you look at HR's challenge at a high level, HR has a bunch of things to do every year and not enough resources to do it with typically. They have to get open enrollment done. They have to communicate what the benefits mean to people. They have to manage other ancillary workflows around elective benefits. They also need to make sure that everything like flu shots are happening in the company, and they have to make sure that folks are recruiting and retention of talent is happening. It's a lot of workflow and not a lot of thanks, and it's also relatively low engagement on a per-employee basis in terms of how folks participate in their performance reviews, how they participate in recruiting new talent, or how they participate in their benefit selection or benefits utilization. So HR has an engagement challenge they always have to deal with busy employees who are relatively disengaged in general. That's been a trend that's been going on for 20 years. And the challenge that we're helping them solve is by making HR workflows like open enrollment more fun and social. By gamifying it, we can actually drive up engagement. And the benefit for HR is help them get their work done faster. This is the HR department here. by making the process pleasant and easy to use versus a lot of paper and or a classic enterprise software experience that no one wants to deal with.
So this is in place now for this fall's open enrollment period?
Yes. So what we can do is we can integrate into any employer's open enrollment system as long as it's online, bake that into the Keas Engagement platform, and then make that social, mobile, and fun for employees so that there can actually be a leaderboard, there can be points and rewards and incentives for those who are first to complete. There can be department by department or location by location competitions in terms of who's finished first with the workflow. And this is really what drives efficiency for HR, because HR, one of the dirty secrets about HR is they spend most of their time chasing employees down to do things like select their benefits.
Right.
And if you can actually bring back, weeks worth of time to the HR department that doesn't have enough resources as it is to communicate out things like the impact of the ACA, you've delivered great value for HR. So this was something that HR departments around the country brought to us as a need, and we're happy to fulfill and announce with you. The other kinds of things we hear a lot about similarly are training and compliance. Typically a pretty drudgerous workflow that no one wants to deal with, and it also has low participation and engagement, and HR has to chase the employees down. We often have to, we're being asked to integrate that now into Keas too. So we look forward to announcing more of these workflows with your audience. But HR open enrollment is really an extension of benefit selection, which is primarily focused on healthcare. And since we've been driving record engagement in healthcare benefits and utilization, and we're asked by our customers, could we do for open enrollment participation and completion what we've done for health benefits utilization, we were happy to step in and do it.
Josh, quick question. This is Brent. What's the role for a broker with this type of solution? A broker's a lot of times engaged in the open enrollment period and helping their employer clients. Is this helping the broker? Is it obsolete to the broker? Kind of what's the thought on that?
Well, it really depends. We work with brokers all the time at Keas, and what we find is that there are two ways, broadly speaking, employers can run an open enrollment workflow. One way is on paper, and we see that more than I'd like to admit. It still happens, and that's because many employees at America's largest corporations don't have email addresses and don't have knowledge worker jobs, so they have to have a paper process.
Mm-hmm.
Where there are online process and workflows and online portals for open enrollment, that's where Keas typically gets involved, because we can, if you think about it, there are very few enterprise applications, particularly when it comes to HR, that employees love to use. And the reason that we're in this space now is that employees love Keas because it's social and it's fun and it gamifies health and wellness. And so by making other relatively boring workflows fun and social and making lemonade out of lemons, if you will, in terms of the employee having to get this stuff done in a way that's fun, rewards them, they can share and compare notes with who got it done first and get the incentives that are offered for early completion, we can actually drive more efficiency by simple behavioral management around the employee base.
Well, Josh, thank you so much for joining us today on Healthcare Consumerism Radio, and we look forward to hearing more from you. To the rest of our audience, please stay tuned for the next segment of Healthcare Consumerism Radio.